I'm sorry for the technical glitch. Uh, what has happened is that most of the people are working from home these days, so the loading on the internet connectivity is very high. Because of that, the connection breaks down in between. So what I'll do is I'll repeat this particular slide because it somewhere midway stopped in the last lecture. So we were talking in this particular slide what is the regulatory classification of the co-crystal, which in other terms mean that how do the regulatory agencies like US FDA treat co-crystals. So if there is a company who wants to introduce a product that has been made not with the API but with a co-crystal of that API, what would be the regulatory pathway that is going to be followed? So as per the US FDA guidance document, which was published in August 2016 and which was subsequently updated as well, co-crystal is considered as a polymorph of the API. Specifically, it is not regarded as a new API. From a regulatory perspective, drug products that are designed to contain a new co-crystal are considered analogous to a new polymorph of the API. Why is this stand taken by the regulatory agencies becomes the obvious question. Now, the US FDA's view on this particular issue is that the definition of polymorphs in the US FDA includes amorphous form, solvates, as well as hydrates. And as per this current regulatory scheme, different polymorphic forms are considered the same API, which means if you want to develop a generic product for an existing innovator product, you are free to use any polymorphic form, which could be a crystalline polymer, which could be amorphous form, which could be a hydrate, or which could be a solvent for the development of the generic product. So the solid forms are considered same as the API. From a physical perspective or from a physical chemistry perspective, co-crystals can be viewed as a special case of solvates and hydrates, wherein the second component in the crystal lattice, the coformer, is non-volatile. In the case of solvents and hydrates, it is going to be a solvent or water, which are volatile at room temperature. But in the case of the co-crystal, the second ingredient is non-volatile. Otherwise, it is similar to a solvent or a hydrate. Therefore, the co-crystals are classified as a special case of solvates. However, if unit cell of the crystalline phase contains both co-crystal and salt components, that is, there are ionic and non-ionic interactions occurring, as is the case in salt co-crystal, the system will be treated as a salt, not as a co-crystal. There are many co-crystals that are right now in clinical trials or in the market. This table gives you three such examples wherein the co-crystals are in phase 3, phase 2 and phase 1 of the clinical trials. And there was a recent approval of a pharmaceutical co-crystal in the product called as Entresto, which is a multi-drug co-crystal containing sacubitril, disodium valsartan and water. So this was approved by the US FDA in July 2015. As you all know, the problem of aqueous solubility is becoming more and more severe in the pharmaceutical development pipeline. So it is highly likely that more co-crystals will be coming into the developmental pipeline as well. And this trend may increase in times to come. So with this, we end this particular presentation on co-crystals. As we had discussed in the WhatsApp group, I'll be taking up all the questions related to these presentations one by one through the WhatsApp group. So you can post your questions there so that the other students can also see the question that has been posted. And obviously, they'll also be able to see the answer to that particular question. So thank you very much for joining in this unique initiative of classes through the online platform. We are going to continue the other topics as well through the same route.